Today we're having our people's event. We're beginning to look at the CDC and its collapse in many ways in terms of guidance. We're here to bring things together to sort of create a new coalition of forces to address what's happening today in this moment of crisis, as well as challenge and opportunity. I'll be introducing our panelists, and my name is Edgar Rivera-Colon. I'm a medical anthropologist. I teach at the Keck School of Medicine and Narrative Medicine and do the gift of Zoom at Columbia University's Narrative Medicine program today. And certainly I just want to be aware that although there's lots of us, there are many people who couldn't attend for various reasons, but there are also a lot of us who have relatives and dear ones in this crisis, and we know that they're present with us in other ways, including my own mom. And today I just found out, I'm COVID positive, so is everybody in my family right now. And so we're taking action. We're gonna, mourn our losses and also be militant about the kind of tender militancy or tender militants we need to do this kind of work. So today I'm going to introduce Dr. Rob Wallace, who's an evolutionary biologist, one of our great comrades who's doing work for pandemic research for the people. And Rob is also the author of Don't Miss the Book, Dead Epidemiologist on the Origins of COVID-19. And he'll be doing sort of a bit of a entry piece, and then we'll something from Justin Feldman. And Justin is a social epidemiologist from Harvard, but very interested in social justice issues, environmental issues, and the question of incarceration. And I also want to recognize Daniel Joseph, who is the hub organizer. And I'm getting your bio here, Daniel, because Daniel Joseph Wiley is the managing director of the hub, with a background in the arts, community organizing, and housing policy at the state, local, and federal levels. And of course, we have Dr. Mindy Full-of-Love here, who's a social psychiatrist, one of our mentors, someone who brings community together. And as we say in Spanish, tiene convocatoria. She knows how to convoke people and get them to do things. And I hope that we can benefit from all the wisdom that's in this room today, ours and yours. So let's begin a little bit with Rob. If Rob, you can say something right now.
Let me unmute myself, as one needs to do if one's going to serve on a panel. So thank you very much for introducing us, Edgar. Yeah, some of the other panelists are going to be getting at the deep digging of how we ended up here at the end of Biden year one, and also the ways and means by which we can get ourselves out of it. I was asked today to kind of give a little background on some of the things we might do in our everyday life, and clearly there has to be some sort of community-wide and governmental responses. But there's a lot of confusion in terms of and conflicts of interest that appear inundated at the Biden CDC, as they were at the Trump CDC. And so there's an aspect of what do we do in terms of our immediate safety presently. So I'm going to talk a little bit about that, and talk about what we might do at the individual level, the household. So, to begin with, and I think Justin's going to get more into this, I'll talk a little bit about how we got to this spot and some of the kind of malpractice that's gone on here. So I'm going to share my screen here, and there you go. So this we start off in January. Biden administration's kind of behind, if only by virtue of what happened previously, not only under the Trump administration, but back several decades in terms of neoliberal kind of public health. Public health's been largely dismantled. and so on and so forth. But, two immediate things that come on mind is that there's no Tetris program, in the sense of there's no national testing or tracing or isolation kind of programming. There's no national genomic sequencing program in terms of our viruses, so we can have an idea about which viruses are where and how they migrate, and not just from state to state or county to county, but even at the block level and even from apartment to apartment. We can get a handle on where things, the virus is moving. By March, though, the Biden team start to do their own business. It's their administration, and we have here the kind of the beginning of the end of the kind of COVID social supports that were implemented in 2020. So we have, this month we have here the kind of the end of the monthly child benefits that millions of Americans depended on. That follows the end of the Paycheck Protection Program last March, the end of the stimulus payments last spring, the eviction moratorium ended in the summer, and the expanded unemployment benefits are ended in September. And so I think it's very clear that the administration's intent on driving the workforce back to work. And this notion of being taken care of by a government during a crisis is something that is not to be accepted. Also in March, we beginning to see as the vaccination campaign goes on, we begin to see a movement toward characterizing COVID as a pandemic of the unvaccinated, blaming the unvaccinated for their own deaths and illnesses, as if the vaccinated can't get sick. They can, although certainly not at the level of those who are unvaccinated, but it's not a sterilizing immunity. We also, of course, vaccinated can also pass on the infection. And the harangue there is a kind of legitimizing the vaccine-only strategy there. Never mind that vaccine hesitancy and vaccine skepticism are also markers of the failure of vaccine access. So, we can ask, where's the door-to-door campaign trying to talk to people about vaccines and what's needed and why you should get it, So at the same time, domestically, the administration has put the onus on the unvaccinated as a problem. Internationally, there's no effort to try to get people vaccinated abroad. So the administration has come out for exempting vaccines from the World Trade Organization's TRIPS protections for intellectual property rights, but US vaccine policy is effectively being run by the pharmaceutical sector. Famously, Bill Gates and his pharma colleagues were able to flip the initial WHO model of open medicine to the COVAX model of covering only 20% of the poorest populations in some of the poorest countries. But even that deal had fell through, and now it's all just a mad scramble for particularly among the richest countries able to score the vast bulk of vaccines and boosters, and many of the companies failing to follow through with their promises to the poorest countries. So in May, when the winter wave was in retreat and vaccination going well, then the Biden administration, against evidence to the contrary, nearly all epidemiologists outside Atlanta, they moved to free the vaccinated by recommending they no longer needed to wear masks. That, of course, they would eventually reverse the recommendations after they were shown to be completely inappropriate. But even at that time, we knew that that was not the way to go. In December, we have a sweep of ill-considered decisions. Omicron's already here stateside. The administration proved late in moving toward providing Americans in-home COVID testing. They're now finally getting around to doing 50 million of the 500 million tests that they promised to be delivered at the end of this month. So those of you who have Omicron already, Edgar, I apologize. The federal government was not able to provide you your test. The test that you may have bought won't be covered by the federal government either. And of course, if you want to be paid for it, you'll have to haggle with your insurance company. There was also the aspect of, at the instigation of many of the corporations, against the sum of all the epidemiological data, CDC rolled back its recommendation for quarantine upon exposure from 10 days to 5. And almost all the evidence about the COVID's incubation period, its generation time, its serial interval, favors the 10 days. I mean, there's a reason why that number came about. It's from the evidence of the virus itself. And so sending people back in to work or school. Oops, my apologies there. I see that my slides weren't moving forward. Is that, can you see them now there? Okay.
We still just see the PowerPoint slides. Rob.
Is May, do you have May there?
No, January and March still only.
Okay, I'm moving that forward. Do you see it now? No.
No. Maybe if you, I think you might be sharing the screen before you went into presentation mode.
Okay.
Oh, there we go. Now we're good.
You got that.
We got
that. Move forward, is that right?
No, it stays on the.
Okay. So I'll do it this way then.
Yep.
And you can see all the things going on there. It's okay. So we have here May and December there. And in terms of the tests themselves and not being available, only 50 million by the end of January, even as they promised 500 million. Take-home tests are by the in-house tests or the are by themselves problematic because of many of the false negatives as well. So in the CDC also moved toward moving quarantine from 10 to 5 days. Okay, right, so that's the terrible thing about moving it 10 to 5 days. It does not speak to the biology of the virus itself and the way that infections are transmitted. So someone late in their infection can still pass it on. This is why it's not just about any magic number, 5 or 10, but it's the variation in terms of when people are infectious. And of course, finally, for now, the Biden administration, not just the CDC director, has been pounding the upbeat talking point that only those who are dying are those already with comorbidities. All of us in our lives will at some point have comorbidities. So the notion that it's okay that people who are dying are the ones that who are already sick for other things is, of course, eugenicist in its outlook. And never mind that all the hospitalizations, the many who are suffering from long COVID, the additional deaths from being of all the programming dedicated to abandoning flattening the curve. So, the outcome, of course, is that we have, explosion of COVID cases here in the United States, even though the United Kingdom is in decline, the US is still going on. These are 7-day rolling averages from today. We have deaths accumulating. The US is not anywhere near its deaths of last winter, but we see here that we were clocking in 1,000 deaths per day since the late August, even before Omicron came about. These are the daily new cases per 100,000 population for, I think, the last 7 days. So again, widespread. This is the ICU occupancy rate. So although hospitalizations aren't as serious, we can see many in ICU across the country, across many counties are being inundated. These are deaths per 100,000 population, I think, from the beginning of the epidemic. The reason why I show it too is because some states are just flat out deciding not to report their deaths rates. So the federalism that CDC ostensibly is involved in appears to be crumbling a bit. New York City, these are 7% positive in the last 7 days. We can see some zip codes clocking in near 40%. We have hospitalizations over the last 28 days per 100,000 people in New York. And the point is that there are lots of COVID out there. And there's even still Delta variant still around. And again, a small proportion of people killed by a large number of infections is still very much a large number. So there's no rapid decline that we're repeatedly promised. There's plenty of food to feast on in the sense of 84 million people are still entirely unvaccinated in the United States. Many million more don't have that second shot or the booster. Now, the reason why I bring all this up is not just to introduce things, but to kind of speak of like what does this mean for us at the individual level. And this is what I would recommend. I'm not the CDC. And ultimately, if we do come up with a working group as a people CDC, my recommendations should be, vetted and changed and all that. But I was asked today to say, what would I do? What would I recommend? One, yes, I would say do get vaccinated, including your booster if that's possible. You do wear your N95 mask. Don't do the cloth mask anymore. And even the blue surgical mask, get an N95 mask. Wear it in all indoor places, not home. And I would argue also in crowded areas outside. Do not assemble inside with people beyond your pod. And the reason why I bring up the notion of a pod is that, ostensibly in a real working public health, we would have hired 1 million, 2 million community health workers to go door to door, checking on people to see how they are, because staying home is really difficult. And we have all sorts of more comorbidities that come out of people not doing well or being isolated from each other. This is about community, right? And to isolate from each other during a difficult crisis is a terrible, difficult thing. So if you are able to isolate on your own, great. But if you are need support, then you find friends or families or neighbors by which that you can keep in contact with to provide each other the kind of support you need, and logistical support and moral support. I'm a big fan of washing hands. I know this is an airborne disease, but it's not a clear dichotomy between touch and breathing. Those things are combined. So I would say do it when you get home, do it before meals. Now, the thing is, not everybody can stay home. If you're forced to go to work or school, I'm sure this will come up in the conversation. You can wear masks. Do wear masks at all times if possible. If you can keep your kids home from school, I would say do so certainly for the next 2 weeks. Some of the school districts try to really push the Biden programs and make sure everybody send their kids home. And many counties and city is now abandoning that because of Omicron, not only affecting students, but teachers as well. They don't have the capacity to do that. But, some parents still need to send their kids to school. If we can keep kids at home as we can in the next couple of weeks, and these are recommendations for January, I would say that would, in essence, flatten the curve as it were for the schools as well, because they don't have the staffing now presently. I would say that given all the false negatives, delays and shortages in our rapid antigen tests, and given that Omicron is everywhere all at once at this point, if you're sick and you can't get a test, and given all the problems with that test, just presume that you have COVID, okay? If you are sick, isolate 10 days, don't do the 5 days. And I would say from the first day of your symptoms. And finally, if without symptoms, you can get a rapid test if you can, or a PCR test, but it's worthless if you have to wait for the results for more than a couple of days, because at some point, you continue to live your life and you might get a nice negative, but along the way, you might have been infected. So that is, otherwise though, if you can't get these tests, just assume you were infected, even if you don't have symptoms, and isolate the best you can. And I understand the difficulty, and this is the pressure that we're getting in the other direction. All the support has been stripped out in a way that would force people back into school and back into the labor market. And this is the conflict that we're at this point, that biologically and epidemiologically, we should intervene in such a way to allow people to shelter in place or to isolate. And instead we have a push toward keeping the infections going. And so I'll end up here with these. Again, these are my recommendations. Some of them speak to the biology of the virus. Some of them respond to the administration's recommendations, both pro and con, and some of them speak to our present Omicron moment. And in the end, however, I think it's the big switcheroo in how COVID public health is pursued. And I believe that Justin and Mindy are going to be talking to those issues, because we can recommend all these individualistic level things to do, and I've tried the best I could. But in the end, really, many of these things will only work if we have a social system dedicated to protecting people over profit. Thank you.
Thank you so much, Rob. Thank you so much, Rob, for that. Can everyone hear me? We're okay? Yeah, excellent. So right now, we're going to do a couple of things. And we've really appreciate, Rob, the broader analysis, but also the concrete 9 steps or 10 steps we have to take as a matter of self-defense, right? Of care, but also casualty mitigation. This is what we're dealing with right now, casualty mitigation. And today we have the pleasure of hearing from Justin Feldman. Dr. Justin Feldman is associate epidemiologist at Harvard. And we've had I wouldn't say the pleasure of reading your article. It was a difficult article to read, quite frankly, but the insights that he offers. So Justin's going to talk a little bit about the article that he published in The Atlantic. And then we will have Mindy to talk about some of the ways to exit this social trap, as well as a community response from our own Daniel Joseph Wiley from the Hub. So Justin, please take it away. Give us a sense of the article, why you wrote it, and what you said.
Yeah.
Thank you, brother.
Thanks so much, Edgar. This was actually just an article I posted on Medium and was later posted on the Harvard Petra Flom Center's blog. And if you haven't had a chance to read it, I'm sure we can send out a link, but I'm going to give a 13-minute overview, but I'm actually gonna start with the Trump administration and work my way up to the current day. So the COVID pandemic first hit the US I think the WHO declared a pandemic in early April. What happened in the United States was something pretty exceptional. You had a dramatic expansion of the social welfare state. And it happened in 2020 with Trump as president and with enormous bipartisan support. And this comprised 2 main pieces of legislation, the CARES Act and something called the FFCRA, Families First Coronavirus Response Act. And what these pieces of legislation did was, most notably, in my view, add $600 to normal unemployment insurance, making it so that the vast majority of people who became unemployed, either because their industry suffered a lack of demand related to the pandemic, or the businesses were restricted or closed as non-essential businesses as public health measures, the vast majority of them were able to receive more from unemployment than they had on the job. Under the FFCRA, they got paid sick days for the entirety of 2020. They also became eligible for Medicaid. So this extra $600 didn't count towards your Medicaid eligibility. There was also provisions that remain in place, thankfully, one of the few, that make it so that once you're enrolled in Medicaid, it's pretty hard to kick you off. Unlike normal times when you have to recertify, your income goes up. So and then there was money from the CARES Act meant to keep businesses afloat. And there's some controversy with that money. There was not much oversight necessarily. Some of it may have been misspent. However, it was able to provide political support for restricting or temporarily closing non-essential businesses. Depending on where you lived in the US, you may remember having to wait in line to get into the grocery store because there were capacity restrictions, or perhaps the mall was closed, that sort of thing. And those policies were implemented at the state level, but enabled by this federal legislation. And even in red states, they were implemented, if only for a few weeks, starting in April 2020. And these non-pharmaceutical intervention policies, or NPIs, we know from lots of research out there, led to a dramatic decrease in deaths, even before vaccines were available. And I argue that this legislation, these measures, were possible for a couple different reasons. The more mundane reason is that we didn't know how long the crisis would last. There were kind of rosy projections that by the summer, things would be back to normal. But the other uncertainties were who would be harmed both economically and epidemiologically. It was unclear whether politicians, corporations, the wealthy segments of US society would be able to go on about their lives relatively unscathed economically and kept out of the most severe COVID outcomes, being hospitalization, death, though we're not going to think about long COVID for now. It became clear, two things became clear over the following months. One, the pandemic was not going away anytime soon. And two, most of the damage, both economically and epidemiologically, is going to be concentrated among the populations that had the least power in the US and that already experienced the highest burden of diseases. And these are working class people, especially working class people of color, and disabled people and older people. And in my research, I found one, in the first 400,000 deaths from COVID that occurred in the United States, only 4,000 of them, or 1%, were white, college educated, and under 65. And I also found that if everyone died at the same rate of college educated white people of the same age and gender, we could have prevented 90% of deaths among younger people of color below 65, and 71% of deaths among all people of color. And then during the first year of the pandemic, billionaires gained in aggregate trillions of dollars in wealth. The stock market went up, GDP rebounded. We had all of these indicators that life was going to be okay for not just the 1%, but actually a large swath of the privileged portions of this country. And then we had an abandonment of these commitments to, on the federal level, social supports, and on the state level, the non-pharmaceutical intervention policies that were enabled by the social supports. So I'm going to kind of gloss over Trump's interference in the CDC and kind of misleading statements he made about science. I think those are all fairly well known. And I'm going to fast forward to Biden winning the election in November 2020. There were some early signs of warning that the response might not be considerably better. There were also some promising signs. So a couple of the early warning signs were, one, after weighing it within the transition team, the Biden administration decided not to warn people against social gatherings for the holidays, despite virtually no one being vaccinated and rising COVID cases. We also had the appointment of Jeff Zients as the White House COVID czar. So Zients is someone who has the most authority over federal COVID policy right now. He has no public health background. He has a background in management consulting and private equity. And he was known as under the Obama administration, he was known as the ambassador to the business community. Just one of the most pro-business members of either administration at this point, I think we can say. At the same time, Biden came in with a plan. This plan is still online. It's a PDF, a National COVID Response Plan. It isn't perfect. It never mentions restrictions to businesses or closures of non-essential businesses, but it does mention federal guidance to state and local governments for mask mandates, dramatically increasing testing, hiring 100,000 public health workers to help with things like vaccination and testing. There were a wide range of measures in this plan that would have been very helpful, where there was never even an attempt to implement them. There are real constraints in the Biden administration's power. We just saw today the Supreme Court blocked an OSHA regulation that would have required either vaccination or testing in large workplaces. So those constraints are real, both from the judiciary and from the Senate, where despite having a majority, there are a couple of Democratic senators who don't provide reliable votes. And there's also this need, not really need, but this tradition of going through the filibuster. So requiring all the Democrats to be on board. That said, I think if you read my article, I lay the case out pretty clearly that the Biden administration has made a combination of unforced errors, moves that would not have required congressional approval or would have been relatively uncontroversial. And they've not chosen to pick fights that they may have won. We'll never know. And I'll highlight a couple of the major points. One is that I think there was this shift to a vaccine-only strategy even before the presidency began. Once they saw 95% efficacy by Pfizer against severe disease, I think we saw an effort to, rather a plan to abandon non-pharmaceutical intervention policies once all adults were eligible for vaccination. So what we saw once May 2021 rolled around was three things. The one that's highlighted most is this decision to advise vaccinated people to not mask in indoor places, despite somewhat uncertain science, and despite it being impossible in many institutions to police whether or not someone is vaccinated and therefore whether or not they should mask. We also the same week saw an abandonment of an original OSHA standard, not the one that we're seeing struck down today. It had nothing to do with vaccination. It was about masks, ventilation, paid quarantine and isolation requirements for nearly every workplace in the country. And we had this dramatic shift in language towards individual responsibility. So we had CDC Director Michelle Walensky say, your health is in your hands. And ever since then, we've had this kind of tepid vaccination outreach from the federal government that hasn't involved large-scale public health measures. Those public health measures to do outreach have taken place at the state and local level, but largely not at the federal level. So we continue to have large unvaccinated segments of the population, many of whom are low income, don't have health insurance. We continue to have enormous racial and economic inequities in COVID deaths, particularly among Indigenous peoples, particularly among Pacific Islanders who are dying at 3 to 4 times the rate age-adjusted of white people, and no targeted deployment of resources towards them. So when Delta and then Omicron hit, and the protectiveness of vaccines weakened to a degree, particularly weakened against infection and transmission, while still providing good protection against hospitalization and death, we did not see new measures being implemented or even proposed at the federal level. And that's what really brings us to the situation today. So we are in this situation where Omicron is being allowed to rip through schools and rip through workplaces. And we're doing things like shortening the isolation period to try to not have this disruption to the economy, because the alternative would have required these social supports. The Biden administration decided not to renew expanded unemployment insurance beyond September. That was a very deliberate decision. They continue to stand by. So we have no choice but to plow through it, which has led to what, in my view, is some pretty disheartening and even scary soft denialist rhetoric about what they're portraying as the mildness and lack of harm of the Omicron variant. So I'm at about time, so I will hand it back to you, Edgar.
Thank you, Justin. That was thorough, succinct, politically alert kind of writing and public health we need at this time. And you could see the chats, people are just riffing and adding and asking what happened to social distancing. I like to call it solidarity distancing, and all the possibilities that this administration could have if it just got its act together and did its job. Apropos of that, we're going to have about getting something done. We're going to have Dr. Mindy Fullove talk right now and talk a little bit about ways to exit that social trap. And one thing I just want to say before Mindy does her stuff is I came out of the HIV/AIDS movement, and there was a long process of mourning before we became militant. And I think these kind of meetings are the beginnings of structuring our militancy and our care for each other, that we're doing this out of a sense of urgency, but also out of a sense of love. Love built this house. We're going to build more than just this house. Okay, so Dr. Fullilove, Mindy Fullilove, please join us and add your wisdom to the table.
Yeah, thanks so much, Edgar. I have to find the right thing. I always want to press share, but it's not share. So I'm Mindy Fullilove. I'm a social psychiatrist, and so one of the things that, you know, when we were thinking about doing this, one of the things that's on my mind is that Americans have, the whole nation, perhaps the whole world, but the whole nation has reached a level of anxiety because there's this abandonment that Justin just described, and you know, real abandonment and confusion. What am I supposed to do? There's confusing messages. And of course, people actually don't want to hear the hard truth, which is if you're infected, stay by yourself for 10 days, or if you think you're sick, stay by yourself for 10 days. So they'd rather hear the softer message, but the softer message is wrong. It's creating great anxiety and great real fear. And Roderick Wallace, who's a mentor and colleague of mine, has been sending me articles about the issues of when fear at a population level really becomes mass panic and things fall apart. So part of the impetus, I think, for this meeting and for, I'm sure, many meetings by many groups that will follow is how do we pull back from that edge and get on a sensible platform so that we can deal with this and really move towards something that's not the whole society falling apart. I'm really speaking on the basis of a guide to learning to how to do community-based planning around pandemics, which was written by this group of people. We called ourselves the Pandemic Think Tank, and the University of Orange Collective Recovery Team helped by editing and designing, and we will put the link to this guide in the chat. An assumption that we work from is Rudolf Virchow's famous, if a disease is the expression of individual life under unfavorable conditions, then epidemics must be indicative of mass disturbance of mass life. And we all know that mass life was very disturbed when COVID arrived, and COVID revealed all of the problems, some of which Rob and Justin have alluded to. So in my own studies of epidemics, and I've watched quite a few in my career, I've studied the AIDS epidemic, the crack epidemic, the violence epidemic, etc. I've found that there are three steps that are involved. One is recognition, the acknowledgement by society. The second is resources, the decision by society to commit resources to the management of the epidemic. And the third is realignment, that if it's a mass disturbance, you don't solve the problem by the same social organization in which it first appeared, that there's some amount of social reorganization that occurs in the process of managing an epidemic. I think this piece is the least recognized in thinking about epidemics. We also pointed out that there are three partners, and each partner has tasks: the government, which coordinates policy and mobilizes resources; the public health field, basically, which leads research and prevention activities; and then community, so sort of all of us, which mobilizes people to participate in the public health strategies, like getting vaccinated and wearing masks. So what did we learn from COVID? First of all, the three partners need to be on the same page and working toward shared goals. So the theory, if the three partners are working towards a shared goal, you keep the epidemic to the smallest possible epidemic it can be. But if the partners can't or won't do their work, then the epidemic is going to be much larger, and there's going to be all kinds of other tensions and dynamics. It's going to be quite a fraught situation, and that's the situation that we're in. The second thing that we learned from COVID is that we're in a situation of decades of attack on communities in the United States. And they have developed deep suspicions of one another and of the government. So public health leaders and communities face a very, very difficult task in that we're not looking at sort of a united community that's ready to do what public health leaders say. That's not the case at all. So the thesis that we present in the guide is that there are you're going to have a resilient society when there are lots and lots and lots of connections among people. And those connections are easily mobilize the whole society to do what needs to be done to contain the problem. But in the United States, that structure has been effectively destroyed, we believe. And so what exists is this intense fragmentation. And the fragments are not simply broken apart from one another, but they actually really don't like one another. They're angry at one another. This is a very serious situation. So the third is that there's an important geography to the spread of illness. And this is something that's rarely talked about. So if New York, for example, in March 2020, New York had COVID, everybody else was like, well, that's too bad for New York, but we don't have COVID, end of story, was the assumption. And geographers and people who study the geography of pandemics and epidemics point out that that's not the case at all, that it starts someplace and then it moves. So this means that prevention has to take place at multiple levels of scale, but also means we need to think constantly, where is it going? This is a diagram that's in the pandemic guide. So at the national scale, we're looking at diseases landing in major population centers and then spreading out from there, then diffusing regionally, and then obviously spreading through our networks in the local level. And so thinking at these three levels of scale all the time is really essential. And at some of these levels of scale, we actually don't think at all. So we're missing whole pieces of the geography in thinking about what is our response going to be. Particularly, disease spreads among metropolitan areas, but we don't have organizations of public health, all the metropolitan areas that are then talking to the cities and talking to the networks. So we don't even have the structure to really have the right conversations. So what we believe is that, the essential thing that has to, the missing force is the People's Coalition as a force for effective pandemic planning and response. That this is what is desperately needed in this situation. Then there's also, what is public health supposed to do in this situation? We think two things. One is that there's got to be a people's CDC. There's a lot of progressive healthcare workers, epidemiologists, all kinds of people out there doing public health that know what's going on and that can give good advice, that have to just take the ball and say, we are the people's CDC and this is what you should do. People would like to have a weekly announcement like what Rob said today. This is how we read the data. It would just be reassuring for us to know, no, 5 days is bad, 10 days is good. That's what the people's CDC. This is really important for calming the nation's anxiety, which is reaching panic levels. We don't want a whole nation at a panic. We want them to calm down. There's got to be a people's CDC. And then we've got to fight to rebuild the whole public health system, which has been decimated by neoliberal policies. We went into this pandemic without the resources, without the team to fight, and we need to build that back. And then finally, government. This is the moment when we all of us who were around during the AIDS epidemic are telling stories about how that got done because the government had no intention of showing up for gay people, for intravenous drug users. Remember in the beginning it was gay people, intravenous drug users, and Haitians. They didn't want to show up for the Haitians either. So everybody was abandoned. So how are we going to get the government to do what was desperately needed? The famous, perhaps apocryphal story of Franklin Delano Roosevelt saying to A. Philip Randolph, the great African-American civil rights and labor leader, that he could only act on civil rights issues if A. Philip Randolph made him do it. And what happened, of course, was that A. Philip Randolph went home and met with all the other civil rights leaders and said, let's do a march on Washington. And so with the war right on the verge of starting, the threat that 10,000 or 100,000 African Americans would descend on the nation's capital forced Roosevelt's hand And he signed the Fair Employment Practices Act, which meant that African Americans could work in the war industries. This is definitely what we are faced with, that we have to make the government do what the government's supposed to do. There are, I got a petition today via moveon.org from Bernie Sanders saying, let's all insist that the government give out high quality masks. If N95 masks are what we're supposed to be using, then it is essential that the government provide them to us, because at the prices that they are at, people can't afford them. If we need at-home testing, that has to be provided, and we're only going to get that if, from demands. It's easy to make for me to say I demand a good mask and an at-home test, but that's not going to force the hand of the government that's abandoned us. And so we have to build this larger coalition and make the government do what the government is supposed to do. And I just wanted to remind us that we have done this before, and we have done this recently, and we can do this. Thank you.
Thank you so much, Mindy, for that. That's very helpful, because I think what we're trying to do is provide analysis, but also provide alternatives. And we have to make concrete, active alternatives for the situation and think about what's happening now and what our long-term view is, what our long-term projects are. And that involves community work. It always does. And this is why we have Daniel Joseph Wiley, who's going to be talking to us about the community response and his work. And then we'll have some time for the audience to chip, to sort of bring some comments forward. And then we're going to introduce our working groups, because this, and then, any meeting has to end in action steps, and we got a bunch of action steps for people, and we might as well use this convocatoria, this convocation of folks to do some work and to build the reality that we need right now. So Daniel, please, share your insights with us.
Sure. Thank you so much, Edgar, and thank you everyone else for providing so much great information. I'm gonna let you know right now, I'm so used to following up lawyers and trying to break down what they're trying to tell people in legalese in their jargon. But following, people in the sciences is a lot easier, because you all use the data that us as organizers actually use to make sure we bring into the world to get people to believe what we're telling them, or to convince folks that we have to work in the right direction. Another thing is, so my name is Daniel Joseph Wiley. I am the managing director at The Hub in Orange, New Jersey. I am a Newark, New Jersey native and resident. And my background is mostly in housing policy, but my roots are in community organizing. So one thing in organizing, you're always supposed to meet folks where they are. So I'm going to share my screen, and I'm sorry if this is not where you are at the moment. I apologize, but this is where I was when I wanted to get my information out to folks. So I'm going to talk about the community response. I'm going to give you some examples of different communities and how they responded. One of the communities that I dove into a little bit more, although I've been a part of for a long time, is the Twitter community. And I think Twitter's responses to what's going on now and over the last 2 years has been one, very entertaining, but at the same time, a lot of truthfulness to it. So I'm going to use, this one to start it off, and I'm going to kind of go through a series of other tweets that I think, Rob Wallace, you may have used in one of your articles that, I saw floating around. And, I thought these were perfect examples of, one, the resiliency of communities, especially communities like where I'm from in Newark, which is primarily, 80% Black and brown. And we all know how, based on the data that everyone else has shared, how this impacted those communities. So I just want to have a little bit fun with it. Like I said, if this isn't where you are right now, I apologize, but I just wanted to make it a little bit fun. So this is the tweet that started off with me. It was from Jen Bartel, and or the handle is Hey Jen Bartel, and this was the day of the CDC's initial response to cut down the 10 days to the 5 days as far as when folks can go back into the world after either being in contact or actually having COVID. She says, it feels like joking about the CDC is the only way to process the seemingly absurd fact that yet another institution that is supposed to protect people has instead chosen to protect capital, effectively dissolving whatever small word I don't really use much, so I don't know how to pronounce it, of trust anyone might have still had for it. So I'm going to go from there. And again, going to there, this is one thing. The CDC told us to do the bare minimum, right? This is a great quote. The CDC just announced you don't actually have to wash your hands. Just get the fingies a little wet. I thought that was hilarious. But then I wanted to put this into an organizing strategy. What's the bare minimum for organizing? The bare minimum for organizing is start the conversation. Starting the conversation around these things is very important. Also it's who's starting the conversation. What facts do we have? What data do we have to bring it to other folks to compel or convince folks that we need to push this forward? The other thing is, how are we gaining partners? Are we looking for folks that we usually work with, or are we pulling in folks that we don't necessarily agree upon with everything, but we feel like this is a collective thing that everyone should be a part of? And then this is a response from Joe Biden. And this is also something that hits our communities hard, especially when it comes to poor Black, mostly communities of color, and also folks that are dealing with the digital divide. This is someone, this is the leader of our country. And when I read this to someone, they basically, they said it in Joe Biden's voice, and you're on your own, pal. And this is what he put on Twitter a few days ago when the testing problems were coming up. And just for an example, in the city of Newark, we saw the testing system just totally collapse. Staff was overwhelmed. People that were waiting in line were frustrated. These were days when it was in early morning when it was below freezing. And these are folks that if they go to work late, they're going to be penalized for it. And these are folks that if they miss work, they're going to be in even worse positions. So I thought this was kind of a horrible response to anyone that doesn't have access to anything. He said, "I know COVID testing remains frustrating, but we are making improvements." And he ends it off by Google COVID test near me. If you don't have access to Google, that makes absolutely no sense. But also tells the bigger picture of folks don't have access in general. And we need to find out ways to get folks access to the different things that are out there to help prevent the spread of COVID. And then to go along with, you're not alone, pal, but actually you're really not alone. And I know, Mindy, you touched on this, and a couple of folks, you talked about, the collective piece to this, and it's about coalition building. And to start coalition building, you have to put in that work. This is another great quote from Roy Wood. I don't know if that's his full name, but he always pops up on my Twitter feed, and he always has hilarious takes on things. But this is one of the better ones. This is ones that, if I was drinking something, I definitely would spit it out at the moment. He said, "CDC just said you only need to quarantine if you're on a ventilator, but if your ventilator got wheels and a battery pack, you got to take your ass to work." I worked in the music industry for a while and did radio for a while. When I talked to some of the folks that were more successful in the industry, one of the things the phrase they always says, you got to put in that work. You got to put in that work. And I was able to take that into the organizing strategies as well. And putting in that work, it means, part of that is putting in the work to build these coalitions. This is the exact opposite of the coalition building that we want to do. And I'm sorry for the foul language, but I don't know. But the CDC ain't, but they told y'all to stay home, and y'all went to Miami. This was in reference to Art Basel down in Miami. This was, it's on record that a lot of folks that went down there, they came back and basically that's when we started seeing, coincidence or not, but that's when we started seeing a real big uptick. So coalition building, I'm gonna go into some actual coalitions that were built by the pandemic. These were two coalitions in the state of New Jersey. One was statewide and one is in the city of Orange, where the hub is located. And these are two coalitions that I had the pleasure of working with now and in the past. Compassionate New Jersey is one. It was a statewide coalition that came from a bunch of housing advocates in the state of New Jersey. started by Ironbound Community Corporation. Shout out to ICC if anyone is on this call today. And you know, it was something that we had to do beginning March 2020, when our governor Phil Murphy put the moratorium in place for stay-at-home orders, and the moratorium in place for renters and homeowners not to be evicted. The other one is the Healthy Orange Coalition, and this is a coalition that's been around since I believe 2017, but in the last 2 years, as a response to COVID, really had to put a lot of work with very little resources to make sure that folks in Orange were able to deal with the pandemic in a successful way. So just for a little bit of background on Compassionate New Jersey, and again, I only have 10 minutes with this, so I'm going to try to run through it as quick as possible. The main goal was to protect New Jersey's most vulnerable tenants and homeowners during the health emergency period in New Jersey. This started immediately in March 2020. As somebody that worked on housing policy and as a housing advocate in the city of Newark, you know, the moratorium was in place, I believe, March 19th, and on April 1st, we were already getting calls from tenants about illegal evictions. So we had to spring into action, and you know, part of that, it goes back to starting that conversation. So conversations were started, you know, and then putting in that work. We met weekly, sometimes daily, from 3/20 until last summer, 9/21, when the governor did sign into place more measures to make sure folks were protected. You know, the coalition was made of housing advocates, government officials, legal experts, leaderships, artists, both visual and music. And to the left is art that was made by LNY. Lenny, he's a artist in Newark who's known globally for doing beautiful murals all over the place. But he is a great friend of the coalition that we were working with, and you know, he volunteered his talents and his passion into the campaign. And, you know, one of the things that came out of this is, you know, we successfully pushed policy to protect tenants from eviction. This came with some federal money attached to it, to the point now where folks, even though the moratorium on evictions ended in New Jersey, folks still have protections and access to, you know, monies that are allocated for rental arrears. So, you know, this is all done from, you know, a ragtag group in the city of Newark that had good connections throughout the state, and we're really able to make things happen. So again, shout out to ICC. I love you guys. And then there's Healthy Orange Coalition, which is another amazing group that I'm working with right now. So shout out to Cherie and Ernest, who are working on our Orange You Vaccinated campaign right now. So I put this little Healthy Orange over here. This is one of our team members, Cherie. She shared this with us, and I think it's fun. It makes me happy, so I wanted to share it with everyone. So the Healthy Orange Coalition, the goals are to keep Orange residents informed while stay-at-home orders and other barriers created by the pandemic were in place. Stay-at-home orders are pretty relaxed right now, and there's other things that aren't in place, which is why we're having this conversation right now. Members meet bi-weekly to share ideas, data, and opportunities for residents in Orange. The coalition is made up of housing advocates, resident leadership, educators, and local organizations. And one great thing that came out of this is successfully, and this was in collaboration with University of Orange, which Doug and Mitty and Molly Aubrey are part of. You know, we were able to get some funds together from a very generous donor from Robert Wood Johnson for $100,000 to work on the Aren't You Vaccinated campaign. And this is to get folks in the city of Orange and East Orange, 5,000 folks. Of course, we want to make sure we can go above that, 5,000 folks vaccinated or boosted. And then, yeah, so find the resources. This is one I found hilarious. This was a response to a tweet that came out very early in the pandemic, when folks didn't really know what was going on. But Rish Sharkey says, you know, she said, the CDC says, y'all worry about COVID when the real virus is being broke. Grind in your silence and elevate above your haters. So as the hub and all of us, what we did is we went out there and we found the resources, and that's going back to the money that we got from fundraising to make sure that we can put the work in to get these vaccines and boosters to folks. And then next steps, and this is, you know, we'll talk about this later, but they're predicting another spike of CDC jokes when it hits Facebook in a couple of weeks. And that's just a inside joke for anyone that uses Twitter. The joke is always that things on Twitter hit Facebook a couple of weeks later. But I do want to say this. This is perfect because shout out to Miss Mindy because stepping into action a week later after hearing some of the horrible news from the CDC. We were able to organize this, and then also with the fact that New Jersey right now has over 400,000 positive cases, and that's not including folks that are testing at home and testing positive since Christmas. The deaths have been steady at 100 per day. And it's scary. It's scary for a lot of folks, and especially in communities that have faced the worst of COVID at this point. So we're I think we're gonna open it up for discussion already, and I think there's some working groups that are gonna be in place. But thank you all for your time. Again, it's very hard to follow you folks that do the sciences, but I definitely appreciate you all. Thank you.
Thank you, Daniel, Joseph, and also for just interlacing that sort of popular commentary with the work you've been doing. And so much of organizing is just finding where people are, using their language, and moving forward as well. So I also want to open up the discussion for folks, and I would like to invite Lourdes Rodriguez and Veronica Guevara to make a brief statement just to respond to the panel. And then we need to move on to this question of the working groups. And obviously we need a CDC, People's CDC. We need to put pressure on the federal government. And we also need to do local work around COVID-0 locality. So we're taking it home, not just being abstract, but what is the local piece we need? And we need 3 different working groups to attend to all those things. And we'll be talking about next week, having a meeting exactly for that purpose. So thanks, Dan. Yeah. So if we can get Lourdes and Veronica on, that would be lovely. And it's always good to see Lourdes, who is in a warm climate, from what I can tell. Bienvenida.
Saludos desde Austin, Texas.
Saludos.
We had a high of 74 today. Not that I'm rubbing it in, but
I'm in LA,
expensive.
so.
Okay, so you hear me.
So good to see you, Lourdes.
I'm so grateful for this space for reflection. And I will just very quickly go over the things that struck me from each presentation, and then I'll talk a little bit about the work that's going on in Austin, coalition building wise. So from Rob's presentation, thank you so much for that summary of accountability and calling out, malpractice. The erosion of the federalism of the CDC, compounded by the lack of backbone, for lack of a better word, in terms of maintaining stricter recommendations towards minimizing the spread of COVID, was what stuck with me from that presentation. From Justice's presentation, thinking about how at a moment in which we thought this crisis was affecting everybody equally, that there was an expansion of the social welfare state was surprising, because when we started to realize that it was not affecting everybody equally, then we started to move away from having those kinds of social supports. We abandoned the social supports. So that stuck with me. From Mindy's presentation, the notion that we can borrow hindsight from the analysis of other situations like this, right? Other critical situations, and that we can take heart at the wins of other times, was what struck with me. And Daniel, when you were talking about tweeting as community response and talking about coalition building, what stuck most with me is that people have a way of using humor and using critique of institutions and power as a way to build cohesion towards movement building. And I think that that's a very important thing that we should never take lightly. I put in the chat that here in Austin, the Community Resilience Group started coming together virtually early on in March of 2020, we were meeting daily for many months, and now we're meeting bi-weekly. And the forum that the Community Resilience Trust created was a space for resource sharing and for relationship building, with the goal of making Austin a more equitable city, starting with our response to the COVID-19 pandemic. And I'll just go through some of the wins of the coalition. So, creating stay-at-home and work-safe infographics in English and Spanish, to bringing together a group of maternal health workers and doulas that were having a hard time going into hospitals, and reversing that policy so that doulas could accompany birthing moms, from ensuring that an anti-racist lens was implemented in the way that philanthropic organizations in the city were allocating emergency funding, to getting together with our transit company, Cab Metro, and our school district, Austin Independent School District, to ensure free Wi-Fi for folks that needed it. And food projects, ensuring that food distribution was done in a way that understood the conditions of the moment and the most vulnerable populations, including individuals experiencing homelessness. Fighting to get a mobile a clinic to be able to do both testing, and then when it was time to do vaccination in what we're called the Eastern Crescent of Austin, which is the area where the majority of people of color live in Austin. Doing a research project to understand the disproportionality of impact of COVID transmission among the Spanish-speaking population here. It's been long, hard work, but it is all about building coalition and responding, always making room for the people that have the lived experience to have the platform for organizing and giving direction to the work. Thank you so much for creating this space for reflection.
Thank you for adding to that space, Lourdes, and bringing your experience from our family down there in Texas. And also, I mean, one thing that I would say is that long, hard work is there for us to do, but it also has another name. That's the beautiful struggle, right? That this is our beautiful struggle, along with being long, hard work. It gives our lives meaning and allows us to connect with folks. So we have some working groups we've been thinking about. And I would say at this point, there are three that are important. People CDC, right? And people can connect at that level. So be at the meeting next time around organizing that. I know that Rob's taking the lead on that part. And we can open up our mics, panelists, and talk to each other, right? And also, we're also going to have a group on pressuring the federal government to do its job. And if it doesn't do its job, create problems for them on that front, right? Either way, you're going to have to deal with our faces. And then we're going to think about devising local zero COVID work, and in particular cities and particular parts of cities. And Daniel Joseph Wiley is going to be helping us sort of lead that. So what we would ask people to do is to, connect. Do we have an email link, Doug, or something that we can send for people to sort of, sign up for working groups? Fabulous. Right on target, as usual. And to move from analysis to reflection into action. Now, there's only a minute left from what I can tell. We're running out of time here. And are there any last comments people want to make before I guess we would finish up? The thing is, the working groups are going to meet separately next week at the same time, Thursday, January 20th, 5 p.m. Eastern time, and that's 2 p.m. Pacific time, my time, and people can select their working groups, and we can work from there to bring this to realization. It's slow work, it's not sexy work, but it's necessary work. And it will literally save lives. And of course, beginning with your own. So are there final comments people want to make before I sort of sum it up and go? Mindy, please.
I just want to thank everybody who came. I was just feeling desperate for good advice, and I just know a lot of other people were feeling desperate for good advice, and I feel comforted just that we could gather and start this conversation. It's a very scary situation, and thank you, Daniel Joseph, for your point. I am not alone. We are not alone.
Yeah, yeah. No, that's a great point. Thank you, Justin, for sharing your thought. That's called socializing the intellectual means of production, and we're all about that. Sharing those gifts that we have. Daniel Joseph, again, thank you for your work. Rob, do you want to say anything before we leave?
I'll just say thank you so much for attending, and please do sign up for these working groups, because it's not just about our, talking faces, talking heads here. We do want to get down to doing some of these projects, and they'll be at the same time next week. You just fill in what working group you're interested in, and we'll gather together by Zoom again and just have a much more free-flowing conversation about those topics. So we very much appreciate your attending and look forward to working with you next week.
And as a final comment, since I'm a minister, I'm going to just do a little end point here. Today, we bring light to each other through the process of history, and we work hard to build hope amongst our people. We understand that we are afraid, but we work and do despite our fear. And we know that the creative force that brought us together, that we are cooperating with that creative force to do the most human thing possible, to create revolutionary change, to make this planet safe for love. Good night, my comrades. Take care of yourselves. Mask up, follow the advice of the people's CDC, and we'll be seeing you soon, next week, in fact. Forward, comrades.